We want to go ahead and I'll introduce our panelists. Today we get the privilege of hearing from Sharday of American Non-Smokers' Rights Foundation, Jeff Sokup with Tobacco Free Nebraska, and Susan Tatum with the Lincoln Housing Authority. They're going to be our experts that are going to present and also answer your questions. And with that, let's go ahead and just get started. Shar, if you want to jump in and start us on our education.
Absolutely. Thank you, guys. It's good to be on this wonderful Lunch and Learn with you all. I have to say I live in Durango, Colorado, but my family, I've got some family in Lincoln, and they've talked about the snow there, so it's pretty amazing. So what we're going to do in this quick 30 minutes is we're going to talk about this whole issue of smoke-free multi-unit housing and why should we even consider it. We're going to touch base on secondhand and third-hand smoke and a little bit about electronic cigarettes too. And we'll talk for just a moment about different types of smoke-free multi-unit housing, and then we'll touch on economics and support for this policy change. So moving right along, why smoke-free housing? Well, the science is clear. Secondhand smoke is a health hazard, and there is absolutely zero safe level of exposure to secondhand smoke. It's harmful at even low levels and occasional exposure, and it really exacerbates certain health issues and worsens many health conditions. As you can see here, there's a lot of things that are associated with exposure to secondhand smoke. So let's think specifically about multi-unit housing. You know, we could think about people here in the 4th floor and that upper level. Those residents can be exposed to secondhand smoke from family members or from neighbors because secondhand smoke travels, it drifts through buildings, in and out of doors, windows, even your electrical outlets and gaps around fixtures and pipes. Secondhand smoke gets through that. Up to 65% of the air that is breathed in an apartment can come from other units. And if those other units are smoke filled, that means that air gets into somebody else's home and in ways that affect their family. So therefore, the only way to protect health is for buildings to be completely smoke-free. Now, you know, the great thing about Lincoln and Lancaster County is that there are 10,780 smoke-free multi-unit housing units that are identified as taking this health policy forward. And that equates to about 20% of the total multi-unit housing homes in the county, which is phenomenal. But that's just the units that we know about. Excuse me, there could be other units that are already smoke-free. We suspect there are, that we just haven't heard about them. So this is a major health issue because, you know, when it comes to residents in multi-unit housing, the CDC has identified that 34.4% who have a smoke-free home rule for their home, they experience drifting smoke from other units. Even in New York, 84% of kids in multi-unit housing with non-smokers are exposed to secondhand smoke. That's how pervasive it is. And yet, here we've got this great smoking rate for Nebraska that has dropped to 14.7%. That's amazing. That is huge. What does that mean? As the non-smoking rate would be 85.3% of the population in Nebraska are non-smokers. That's a huge, huge amount. And residents want smoke-free housing because drifting secondhand smoke is the #1 top complaint to many housing providers and health departments. People will call up. I mean, it's the #1 complaint we hear at Americans for Non-Smokers' Rights. People call us and say, what can I do? you know, my health is affected, my children's health is affected, my elderly parents' health is affected by this drifting smoke. What can we do? Nationally, 88% of multi-unit housing residents, including the smokers, believe that residents have the right to a smoke-free building. And this is an amazing stat from Nebraska, that 91.9% of Nebraskans do not allow smoking anywhere inside their home. And for current tobacco smokers, 80.6% do not allow smoking anywhere inside their home, and that's the smokers. So that's huge and wonderful. So let me pass it over to Jeff to talk about young adult residents.
Yeah, one point I'll make, and welcome, thanks everyone for being on the call today on the webinar. But as you look at that data from before that we were just looking at, which is a survey that we do, Jeff Sokup with Tobacco Free Nebraska, and that survey that we do, as you look at those that bottom bullet point, I think sometimes there's a wrong assumption that folks make that every smoker, if you have a smoker or you have smokers in 3 of your units in a building, the assumption is that all 3 of them are smoking inside that particular unit. And as we look at and know what kind of trend is happening and the change that's happened over the last 10 years, especially, we know that a lot of people or most of the people are going outside. So even knowing that 80% of those smokers that are renting within your building, those are folks that are going outside, that they're not allowing smoking within their unit as well. So, and then we also had a survey question asking young adults, those that are 19 to 25, about what their preference would be as far as renting goes. So the question was about all things being equal, all amenities being equal, would you choose a smoke-free rental house or apartment building over a place that allows smoking? And for those, and this was a survey done in 2018, of those 19 to 25-year-olds surveyed, 86% of those surveyed said that they would prefer that, and that of that 85%, 73.3% of that 85 strongly agreed with that statement. So that gives you a better understanding of the marketplace that's out there and the demand and the that's there for that amenity around providing for a smoke-free building.
That's great. Thanks, Jeff. All right. So let's talk about health equity. I mean, that's the hot topic this year. And it's an important one to consider because lower income populations and communities of color, well, they have more secondhand smoke exposure and therefore more health risks because of that exposure. So lower income residents overwhelmingly prefer smoke-free housing, but there's less availability of smoke-free building and fewer options to move because of very few choices. Bottom line, everyone, regardless of their financial situation, deserves to breathe safe, smoke-free air at home. So what about e-cigarettes and vaping? What is that? Well, breathing aerosol from the emissions from electronic cigarettes has health risks, especially to your lungs and heart. And we know how important lungs are in this, this world with the pandemic. The last thing we want to do is to exacerbate the lungs and the heart. So the vape that's being vaped can be nicotine, but it can also be marijuana and other substances. We just don't know what a person is vaping at that moment. And aerosol can drift and deposit on surfaces, which is a third-hand smoke issue. So therefore, vaping, electronic cigarettes should not be allowed in smoke-free multi-unit housing. I mentioned third-hand smoke, and what is third-hand smoke? Well, it's that tobacco smoke residue left behind on surfaces after the smoking has stopped. And I'm sure we all know, we've all been in places where there's a lot of third-hand smoke. We can just tell by the stale smell that's around or the yellow walls. My uncle and aunt They were chain smokers, and you could just, it was like walking into a brick wall, walking into their house, even when they weren't smoking, just because of all the years of smoking and third-hand smoke and the residue landing on the furniture and the carpets, you know, the ceiling ducts everywhere. So in that residue, we have nicotine and tar and other toxins that then remit back into the environment. And I'm probably not telling you anything new, but when children then crawl on the carpets, they are getting that nicotine and tar in through their skin. So this third-hand smoke is sticky, and it sticks to places, and it's very difficult to remove, even in the drywall. So when it comes to public housing, there's, you know, one of the many types of HUD-funded affordable housing is public housing, which are properties owned by a public housing agency or a public housing authority. And it provides housing for lower income families, seniors, and people with disabilities. My father-in-law is in some public housing right now for seniors. All public housing is required to be 100% smoke-free since July of 2018, which is phenomenal. That was such a great thing that happened in 2018. HUD smoke-free rule does not apply to other types of housing, though, and that's where we can pass our policies. So back to Jeff to talk a little bit about the Nebraska smoke-free law.
All right, thanks, Shar. Just to touch on a little bit about what the legal requirements are there that are out there around housing. As a lot of you probably remember, if you were around Nebraska 13 years ago, the state passed the Nebraska Clean Indoor Air Act, which relates to cigarette smoking. What that law did, what the Nebraska Clean Indoor Air Act did, was prohibit smoking indoors 24/7 in any workplace with one or more employee or any public place. And there are very few exceptions to that. So it was a really comprehensive law across the state. I was around at that time with helped with the implementation. And, you know, it's probably a really good example of how behaviors can change. Sometimes there's a fear if you are thinking about implementing a policy for your apartment complexes, is how people might adjust or what kind of backlash that there might be. And just know that statewide, the Nebraska Clean Air Act covers all sorts of workplaces, manufacturing, restaurants and bars and keno places. And so, you know, it was predicted that there was going to be a lot of backlash, especially with getting bars in compliance with that new law statewide. People adopted. People started going outside. One of the things that really helped a lot in that high compliance happening right away when that law went into effect was that we did a lot of education and a lot of work locally, letting folks know about the new law, getting folks ready for it, getting employees and others ready for that implementation. And I think when you're thinking about that same kind of policy development and implementation for a smoke-free housing building or for a apartment complex or other housing facility, that kind of lead time to make sure you're taking the time to let folks know about it, getting them ready for that implementation date will go a long ways towards compliance and enforcement that we'll talk about on webinars next week and the week after. And so that Nebraska Clean Air Act that passed at that time, how it impacted housing was that it required that there would be no smoking allowed in entryways, hallways, laundry rooms, anything that was a common area that folks had access to, laundry rooms, etc. And then this last year, the Nebraska legislature passed LB 840, which expanded the Clean Air Act to include electronic cigarettes as well. So that law went into effect on November 14th, expanding that. So that includes for housing folks that are on the call, those entryways, hallways, laundry rooms, etc. Is not only no cigarette smoking, but also no electronic use, vaping allowed in those areas as well. The law does not address the individual unit within that building. So it's only just those common areas. But the one thing that the law does do is it does allow for individual businesses to go beyond what the law is. There is nothing in the law that says that you have to provide or allow smoking with inside of those units. It's perfectly acceptable for any business to expand upon the Clean Indoor Air Act. So that would include for landlords and property managers to include units in a lease or within a policy that they develop, or for an individual business to expand the policy to include chewing tobacco inside, which is not covered within the Clean Indoor Air Act, or outdoors on the grounds. So we have a number of businesses in Lincoln and across the state that have expanded on the Clean Indoor Air Act to include designated areas outside that are non-smoking, or the entire campus as being non-smoking, which is, again, perfectly allowable according to the Nebraska Clean Indoor Air Act.
Oh, that's great. Thank you, Jeff. That was really helpful. All right. So here's some policy options. So the main policy option for multi-unit housings to go smoke-free is for a housing provider to adopt a policy for the properties they own or manage. And Tobacco-Free Lincoln Lancaster County can help you with some draft language on that. So, the focus in Lincoln is currently on voluntary housing provider policies, and we're all here to help make that happen. So now I want to pass it over to Susan, which we are very fortunate to have as one of the panelists for this Lunch and Learn moment, to talk about our economic benefits for going smoke-free. So take it away, Susan.
Sure. Welcome, everybody. When I started at the Housing Authority almost 15 years ago, it was in a much different role than I'm in now. I was a person that was going into people's homes, and I'll tell you, even 15 years ago, I wish at that point all of our units were still smoking was allowed in, and I was shocked the first time I went into an apartment. It was a duplex, and they were complaining to me about the smoke coming from their neighbors. And for some reason, I just assumed that we were smoke-free housing. And I was shocked to find out that Lincoln Housing Authority wasn't. But really what kind of pushed us towards the smoke-free policy was when HUD came through and said that all public housing needs to go smoke-free. So that was our first project that we did. And then our senior properties, which I oversee now, we had a lot of residents come to us because they really wanted smoke-free in the buildings. And so they really pushed that and encouraged that. And that's how we kind of got started rolling. But when I've talked to our maintenance department, what they've really said is that since the majority of our housing stock is now smoke-free, it has reduced turnover time by at least 50%. And the cost of turning over each unit has reduced by at least 50%. When we would have a smoker that would leave a unit and we'd have to turn that unit over. So it has really decreased our time. It has decreased our costs. It really has decreased the fire risk, because, you don't have that risk of people falling asleep while they're smoking, or, especially in our properties, we have a lot of elderly in some of our properties, and that definitely was a concern with the fire risk there. Our complaints, we do have complaints on occasion when you do have a tenant that is smoking in a unit when it's smoke-free, but we have ways to deal with that pretty quickly and efficiently. Our goal is really to keep people housed. So if we do have somebody that happens to choose to smoke in their non-smoking unit, we work with them first to really make sure that they understand the rules and the consequences of what happens if they do not stop smoking before we immediately take action to terminate their lease. And we find people are very satisfied with our units, and they're really happy that we are now smoke-free. We do provide a smoking shelter at our 3 senior high-rises that are outside. We do have a covered shelter for them that they can smoke in, and they report a lot of satisfaction with that. I think I'm ready for the next one, Shar.
Right. Well, that was super helpful, Susan. Thinking about the complaints, let's see if I can make my PowerPoint work here. Sorry. Sometimes the major complaint in buildings that are not smoke-free is the smoke. So when you go smoke-free, you get to reduce all of those complaints too. Is that a fair statement, Susan?
Yes, definitely. I mean, I came in to the management side of it after we had already been smoke-free. So I really have the experience with my complaints now are people that may be violating our smoke-free policy. But yes, I mean, I did deal with, like I said, I did deal with that issue right away 15 years ago when I moved in, and it was a young mom and her son had asthma. They lived in a duplex, and the neighbor beside them was smoking, and she was just beside herself in terms of how can I need to protect his health, but the neighbors are smoking, and no matter what we do, we still get the smoke in our unit. And you could smell that strong smell of smoke. There just wasn't much we could do for them at that point. We tried to seal off what we could to make the smoke not come over, but it's just too hard to completely stop that from happening. So.
Yeah, great point. Well, now we're at the question part for our panel. So I think what I'll do is stop the share and turn it back over to Sophia. And thank you, Susan. That was really helpful.
Sure, you're welcome.
Yeah, definitely. Thank you to all three of our panelists here. Go ahead, and if you have questions, post them in the chat and I can relay them on, or if you'd like to just take yourself off mute, you can. But while we're getting started, we had a couple come in with registration. This one's probably for the entire panel. We had a question asking, how do I share some basic information on benefits so that I'm more fluent in the verbiage other than just saying don't do it?
Well, I can give a little.
Oh, thank you.
Go ahead. Well, I can go ahead. When we first thought about going smoke-free, what we did is really send out just informational. We worked with the Lincoln Lancaster County Health Department that became our partner in knowing that our plan was going to be smoke-free, and just sending out information to them on benefits of smoke-free housing and talking to them about the fact that we were looking at going smoke-free and really talking to them and getting their feedback and their opinions on the whole process and kind of moving forward from there.
Great. Yeah, and I just kind of want to follow that quickly by reminding everyone that we here at Lincoln Lancaster County are always available for technical assistance. You can just contact us if you want assistance implementing a policy or improving a policy. Just go ahead and give us a call or an email and we'll be in touch right away. Char, did you have some comments too?
Just real quick, and I'm sure you guys have great resources on this too. Often there's little one-pagers that talk about the health effects of secondhand smoke. And it's, sometimes we just post them up in the housing units or put it in everybody's mailbox, just as a little FYI. You could put it in a little postcard form or anything like that. And I'm sure you guys have some great resources that are pretty basic. And that way it's not you doing the talking, it's the facts on the handout.
Definitely, that's a great suggestion. And obviously, yep, that's also available. So if you need any of that, go ahead and contact us. We will be sending our contact information following the webinar with links to a landing page at ANR with the recording and other resources as well. So check that out. We had one more question come in asking if there's any insurance benefits to going smoke-free. Shar, do you want to jump in with that one first?
I'd love to, thanks. I'm trying to be polite and let other people jump in, but yeah, there's such great insurance benefits for going smoke-free, because think about it. I mean, I can't tell you how many times I read an article where a fire was started in an apartment building thanks to one cigarette, and just tragic, devastating fires. And the insurance companies feel so much better if your building property is smoke-free. So yes, very significant financial benefits from the insurance companies.
Great, thank you. Jeff or Susan, do you have anything to add to that? I have another. Oh, No.
Sorry.
Okay.
about
I
that.
have one more
don't
question I want to
have
sneak
any.
in before we finish up here. So I'm going to go ahead and read that one. Are there some tried tools to prove that someone is smoking in a non-smoking unit? We cannot always detect that they are indeed smoking. It's generally the next door neighbor complaining, but the tenant is denying that they are smoking in their apartment. It's a he said, she said situation. And I know we're going to address this more in our upcoming webinars. So Bonnie, go ahead and tune in next week and the week after for a more thorough answer. But does anyone want to give a little high level response?
Sure, I can address this. This is mostly what I deal with now, is that I have a neighbor complaining that a tenant is smoking, and I go to that tenant's unit, and even though I can smell smoke, they'll deny to me that they're smoking. So one of the ways that we really do is first thing I do if I knock on somebody's door and say, hey, I've had a complaint that you're smoking, I'll typically ask them if I can come into their apartment to look around. Because if they tell me they're not, they usually have a hard time telling me that I can't come into their unit also. Or they're just kind of so flabbergasted that I'm asking to come in that they just go ahead and allow me to go in. I don't think I've actually had anybody deny me access to the unit. So that's the first way I walk in. And a lot of times I'll just see proof of smoking and I'll just say, hey, I'm noticing an ashtray here. The other thing that we do is we immediately change their filter in their unit. So we pull the old filter, which we can typically tell is pretty yellow and stained if they've been smoking in that unit. And we put a new filter in after we've said to them, hey, we've got a complaint that you're smoking. You need to stop smoking. Even if they deny it, we tell them you still need, okay, great, but we better not have any more complaints. And then we'll pull that. We can pull that filter again to see after a week, 2 weeks or something, if there is further complaints. But honestly, we've just gone off of if we have a neighbor that complains, and if we have staff go into that unit and that staff smells the smoke, we will consider that valid enough that they are smoking in their unit. We'll give them the chance to stop. If they choose not to stop at that point, we then give them that 30-day notice, which gives them that time to stop. And if they choose at that point not to, then we still move forward with the eviction process. And we've not had any, or I've not experienced any problems when I've done that process of being able to evict someone for smoking.
Great, thank you for sharing, Susan.
I got a little long-winded.
That's all right. No, it's perfect. And we'll definitely delve into that further in a couple of weeks when we have our session on enforcing policy. But I just want to thank our panelists here, Shar and Jeff and Susan. It was great information and fast and furious, but I still feel like we had the chance to learn a lot. Go ahead and plan on tuning in next week when we get to learn how to implement and expand policies. It'll be another quick 30 minutes, and we're looking forward to seeing you then. So enjoy your day. Thank you.